Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Mariano Yee, who is our guest, and Dr. Zahra Figueredo from Stem Cell Healing Institute. How are you guys?
Very good. Thank you, Luis. How are you?
I'm doing great. So we're doing this remotely from Guatemala, and I'd like to say that, we do have this special guest, Dr. Mariano Yee. He's very respectable ophthalmologist here in Guatemala. So we do have a few questions for you guys. So why don't we start with Dr. Yee? So Dr. Yee, how is your approach as a medical doctor different from naturopathic medical doctor like Dr. Figueredo in how you treat your patients?
Well, Luis, thank you for having me here. And this is a very interesting question because I think that medicine have different ways, and one disease I can tell you, can be treated differently. There are many approaches for this. So for example, me as an ophthalmologist, if you see a patient with cataracts, you have to remove the cataract and implant an intraocular IOL. But if we have a patient who has something that is
Degenerative?
Yeah. Mm-hmm. So then you can have Dr. Zahra's approach, So rather than compete with each other, they complement each other, So by doing this, I think the patient gets a big benefit, because this is not a fighting between different approaches,
right.
It's more like what is the best for the patient,
right.
Each disease, has different ways to approach it, Ones are better than others, So this is a good example of how we can tackle the disease, Sometimes it can be done by surgery, sometimes can be with stem cells, So that's what we do.
Right. And I just want to say that I'm so happy to have my friend Mariano, Dr. Mariano with us. He is actually the renowned Mariano Yee from Visualiza. When I tell my patients, my eye patients, that I work with Dr. Mariano, and they say, "Oh, is that the one from Visualiza?" And so I'm just very proud and honored to have you here, Mariano. Thank you for being with us. And I also want to add that Mariano is working very closely with the United Nations Eye and Vision Initiative, and so just really proud of what he does and the amount of social work he does, and giving the gift of sight, which is what I think he calls it. It's just, it's remarkable. So I needed to say that and just praise my friend for a minute.
Thank you very much.
And how proud I am of him. And so just going back to what you were saying, Mariano, yes, I think it's so important that people and patients understand that it's a multidisciplinary approach.
Exactly.
And it's an intermingling of the best of all the worlds. And so it's not one versus another. It's more like combining and, combining the best of everything to have the best possible results for the patient. Because in the end, it's the patient's well-being and the patient's health that we have to consider, and we just want the best for our patients.
Well, exactly, and you know what? And this is a really good thing because we have one way to treat the patient, you have another way, and these together make a huge impact on people's lives.
That's right. That's right. It's about changing lives and bettering the quality of life, and I think that's what we have to keep in mind, and then how our approach is.
So, Dr. Mariano, if someone asks you, why should I consider the stem cell treatment, what would you say to that person?
Well, if someone asks me why consider that, is because, your body has a natural way to heal, you know. And the way your body heals is better than anything else, you know. Your body is a really well-designed machine, you know. So with the stem cells, you know, you enhance this possibility of your body. So if you can find natural ways to get yourself better, you know, is a plus, you know. So if I had the chance to do that, you know, or tell the patient, and you know what, and I already explained that, experienced that myself. You know, I have an injury on my
Shoulder.
you know, on my shoulder,
Rotator.
you know, and Dr. Sarah treated me, and I went like, oh my God, this is great because it's been over a year. No, it's more than that.
More than a year.
Yeah.
Pre-COVID.
It was pre-COVID, and I feel so much better. So I experienced that myself because I am a true believer that your body can do amazing things, you know, but she can make it happen.
Oh, great. So
Yes.
you're not only our collaborator here, you're also a patient of us.
Yes.
That's great. But why, since you're a patient, that's probably why you believe so strongly in what we do at the Stem Cell Healing Institute, right?
Exactly.
Yes, and you know, I wanted to add, which Mariano said very eloquently, stimulating the body to heal itself, right? Which is what we do in so many different modalities. So with the stem cells, with growth factors from the patient's blood, starting with detoxification and then oxygen and the whole, you know, age-appropriate hormone therapy, and the whole comprehensive treatment is just designed to create an environment along with the stem cells to stimulate the body to heal itself. And so I just wanted to add that to what Mariano was saying earlier.
Thank you, Doctor. In your understanding, Dr. Yee, how innovative are the methods used by Dr. Figueredo at the Stem Cell Healing Institute?
Well, you know what, this is quite amazing because what she's doing is really different, you know. She has all the tools are required to make it in a very professional way because not everybody do that, you know. Nowadays you hear some people are doing this and that, but you know what? But doing it in a very professional way is different, you know. And then I remember in the early beginning of these things that people were thinking, oh yeah, we harvest these cells from fetal cells, you know, embryonic, you know, eggs were used for that. But then everything changed, you know, and the way she is harvesting the stem cells, make them grow, and the things that they can do is completely different, you know, completely different to what you hear that people are doing somewhere else. And you can tell us, you know, because this is amazing.
Thank you.
So, Dr. G, do you think that eyesight ailments make people vulnerable?
Of course, you know, sight is it's one of those senses that even if you lose a little bit, you feel terrible, you know. You can not walk, you cannot see anything. I mean, and then people who has any trouble with their sight, you know, they feel really sad, you know, and depressed, and you know, what is going to happen with me, you know. If it's cataracts, you can remove the cataracts, implant an IOL, and they will be happy again, you know. If they need glasses, a pair of glasses can solve the issue. But if they have something else, you know, that can be treated with stem cells, you know, now there's hope. There's light at the end of the tunnel because those people can do something about it because diseases that in the past we couldn't treat, now they can be treated, you know. And what is nice about Dr. Sarah's approach is that, you know, it's not one thing. I mean, she sees the patient as a whole. Going back to your first question, you know, what is the difference between this and that, you know, the two ways of practicing medicine, you know. Her approach is more like holistic, you know, because she prepared the patients in their bodies to get better, you know. but also she's very empathic with the patients. They treat the patients. She treats the patient as a human being, and this is important because the well-being is not just one injection, one thing. Is your soul, your body, everything. So what she's doing is that a really good approach to the problem.
So, Dr. G, since you mentioned a few diseases, can you mention what diseases can be treated with a stem cell treatment?
Well, now is getting better and better and better. You can treat dry eyes. If you have really, really dry eyes and drops are not good enough, or all the other treatments, you can do that. You can use that for dry eyes. You can treat also macular degeneration. Things like that you can treat.
Retinitis pigmentosa. Yes.
Also, you can treat certain corneal dystrophies with that.
Yes.
So
optic neuritis.
Optic neuritis, but this is the beginning of many things, And I think that stem cell therapy are diapers, I can say that, because there's so much to explore, But here is a good beginning.
And as a patient, if I go and receive these stem cells, what would I feel after the treatment? Or what improvements can I notice after the treatment?
Well, Dr. Zahra can tell you more in detail about that because she does the follow-up with the patient and she's very thorough.
Yes, and we do a lot of follow-up with patients as long as we can stay in touch with them. We were talking about one of our old macular degeneration patients, and basically what we see is an improvement in when we have macular degeneration, when we have retinitis pigmentosa, optic nerve injuries. Sometimes there's pain involved. Sometimes there's night vision issues, depending on the condition. There's night vision issues where patients can't drive anymore at night, or they can't look at a screen without there being, like a tunnel vision, or in the case of retinitis pigmentosa, in the case of macular degeneration, there's, when they're in the sun, everything is just sort of, it's like a whiteout for some patients in the way that they've described it. So with stem cell treatment, we have seen patients going from legally blind to being able to drive again, for instance. I've had patients going from not even being able to read a screen to having e-commerce businesses online. I've had patients, what other improvements? I'm thinking of various patients. A decrease in the size of the font, for instance. One patient specifically told me, and this was within days, and I was actually even surprised, where she said that she actually had to decrease the size of the font on her phone or one of her screens because she had it set really large at one point, and after treatment she didn't need it so large anymore. So those are very trivial but very real improvements that we've seen that patients will literally exclaim to me in their astonishment that, "Hey doc, this is what's happening." So it's quite remarkable.
Well, but you know what? But these little changes are really big changes in their quality of life.
Yes.
Absolutely. And may I also ask you, how long is the treatment for the stem cell therapy?
Yes, so it's a 7 to 10 day treatment, Luis, and it's a really nice. We combine so much in that short amount of time, and we need the patient in Guatemala for 7 to 10 days. But the treatment actually lasts up to 3 months by the time they get home, and we send them home with the key hormones and key supplements and things like that post-treatment. in order to keep their the internal milieu in an environment where the stem cells keep working and the body is in the best mode for healing and for the best possible results. So that's how long we actually need the patient in Guatemala, but the actual treatment lasts about three to 4 months once they get back home.
I think that people need to understand that it's not like they come here, they get treated, and I wash my hands, and then you're on your own.
That's right.
Because follow-up is very important. So treatment is one piece of the puzzle. But follow-up is very important because there are many things that can happen in that path.
Exactly.
So people are always with Dr. Zahra, you accompany on your patients.
That's right, and I keep them accountable. There's one thing in particular, especially with my macular degeneration patients, all my eye patients, I tell them really specifically. I mean, among other things, is stay away from diet products. The stevia is okay, but Splenda and sucralose, yes, equal. I don't know if they even make equal anymore. Do they? Mm-hmm. Aspartame, those chemicals have specifically been shown to combat the eyes specifically. And so that's like one thing. And so I keep the patients that have had a habitual one Diet Coke a day, I keep them accountable and I ask them, you're staying away from the Diet Coke, right? And so there's a certain amount of accountability with my patients where I need them to maintain a certain degree of the key lifestyle changes that are sustainable and that are the keys in order to keep them from regressing back with their condition. So it's really important, and that's one of the key reasons I stay in touch with my patients and make sure we address any concerns that might pop up, and of course track their progress. That's a big part of it.
And I do have to ask you, how do you administer these stem cells? Do you place the injection right in the eye, or do you do it by IV?
Well, you know what? This is. I'm glad you asked this because there are some reports of people injecting this directly into the eye that create a lot of troubles. So stem cell doesn't work like that. They migrate whenever they are required. So we put it around the eye, not inside the eye.
That's right. Yes, thank you, Mariano. And that's where Mariano plays a big role in this, because he or one of his colleagues at his clinic will place the stem cells. We call it a retrobulbar injection. And it goes down from the lower eyelid up behind the eye, right next to the optic nerve, right next to the eye. And as Dr. Mariano clearly pointed out, it's around and next to the eye, not in the eye. So we are not risking any damage to the eye itself. So it's a very important point that Dr. Yee made. And also, we place the stem cells IV as well. So we'll place them systemically so that the stem cells go everywhere the blood flows. So we get this whole total body effect as well as that local stimulation as a retrobulbar injection.
Well, I think that for the people who are listening to us, the message will be, go to a place where you can have follow-up. Go to a place where this is made in a very professional way. Because nowadays there are a lot of misinformation. And this is critical. You go where you can receive the best treatment for your condition, and this is a good place.
I will have to say thank you, Dr. G, for coming and give us this testimonial. We really appreciate your time, and Dr. Figueredo, I will see you next week for the next podcast. And you both have a great night.
Thank you.
You too. Thank you.
You too, Luis.
Thank you.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1-209-690-7836. If you want to send us a message through WhatsApp, please add us at +502-4220-7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.